break, and let's just squeeze in Lillian now. Lillian Posadas, our hospital administrator, is standing by. We like to get an update before we head into the weekend, and then one when Monday comes. So, Lillian, thank you so much for joining us. I know you're juggling a bunch of stuff this morning, so good
Yes,
morning.
every day.
And let's just jump
Good
right into
morning.
it. Our census of the hospital. Lillian Posadas, she's the administrator at GMH.
Yes, good morning. Thank you, Bree and Jason and everybody. Our census right now, we have 30 individuals in the house with the COVID infection. Of the 30, 8 of them need the ICU level of care, and of the 8, 5 of them are on ventilator support. At the same time that we have this COVID census, we also have non-COVID census that continue to be on the rise, and so people who with chronic health conditions are coming into the hospital needing hospitalization. So we're balancing that.
The HVAC repairs already beginning right at the SIF.
Well, the beginning is just the discussion with the contractor to get it going. They're still tweaking the design, and so they'll present it to us. And once we review it, and then we can move forward with the construction part of it to get the HVAC separated.
Can you provide any clarification or on this fatality that occurred on the 7th, and it's just now being reported by the JIC 3 days later?
Yeah, we reported it on Monday, the 7th, as soon as we found out. The individual was pronounced at about almost 11 o'clock. I reported it in about 12. And so, they had the information. How it was just published or put out in the JIC yesterday, I honestly have no idea, or what may have contributed to the decision. And it might be because just so many things are going on, that needed to go out through the JIC. And so that may be, or that they just wanted to put the two fatality in sequence in one communication. So that's the best explanation I can provide. But yes, we notified public health on that day.
Okay.
Interesting. Are there any other deaths that were reported that you didn't see put out by the JIC?
No, the last one was that 115th fatality. We haven't had some who are non-COVID. We've lost some individuals, but their conditions are non-COVID.
Mm-hmm. I wanted to see if you had any position on this, because I just got this just a few minutes ago on Bill 239. Are you familiar with Bill 239? I think it's
that's the one that's authored by Senator Mary Torres and Speaker Tina Munoz Barnes regarding the nurse licensure compact.
Mm-hmm.
Right, for Guam to then be a member of that compact. So that way, if Guam is a member of that compact, all nurses who are licensed to practice in Guam, or other nurses who are licensed in a state that belongs to that compact, if they want to come to Guam, the processing of their licensure for Guam is in an expedited mode. It won't take the long process of the documents, verifying all the documents, because that's already done by their state. And so they will then be recognized in a much quicker, more expedient process, and less costly for the individual, for the RN. So that way it's not a discouragement for those RNs who want to come to Guam and practice in Guam. And just like also those military nurses who are active duty military nurses, they want to practice outside of their military hospital. without having to go through the cumbersome process to apply for a Guam license. Their license from whatever state, if their state belongs to this compact, they can get up to a Guam license in a lot quicker process and less expensive, so that they can work, in the community, either Guam Memorial Hospital or Guam GRMC, or even in the community health clinic. They can have that experience, and not just the active military personnel who are registered nurses, but the spouses of those active military personnel, who are registered nurses and would like to work and would like to get some experience and, to contribute to the healthcare system of Guam. They can get that license quicker through this NLC. And so, that's why I support it.
Mm-hmm.
We support it.
Is this an urgent bill where it has to be passed during this legislative session?
Well, because this has been discussed since last year. The National Council of State Boards of Nursing, they were here. They've been Guam several times, introducing this, option for the Guam licensure, Guam Board of Nurse licensure. So it's been in discussion for a couple of years, and we were kind of hoping that this would happen before COVID. But unfortunately, COVID happened, and so I'm just hoping that it can get done before this legislature goes out. And if it doesn't, then maybe next year the new legislature will take this further and get this to become a reality for Guam.
What about this release? That there's a couple releases that came out. One from Senator Mary Torres' office, the other from the Health Committee chair. And in her release, Senator Terlahi writes that the adoption of the nurse compact into law would enable Guam nurses to hold a multi-state license, allowing them to more easily migrate to work in other compact jurisdictions. This ability is a major benefit of compact membership that may have the unintended consequence of compounding the chronic nursing shortage in Guam.
Yeah, and that's a valid concern, but it's happening. It's been happening for many years that a lot of our nurses here in Guam, they leave. They leave for many different reasons, and so that has been happening. It's not anything new. So if it does expedite that process for us to lose nurses, but also it's a two-way street. It gives us benefit to expedite bringing in nurses at a quicker. So, and I understand the concern, but it has been happening for years that we lose nurses.
Right.
And now what we need to work on retaining our nurses.
By paying them more, maybe.
Well, that's one of them. That's one of the, absolutely, one of the strategies. But, we also need to build the leadership and the mentoring on our island so that we don't lose these nurses. We want them to feel that they're committed to stay on island because they have that support and they have the opportunity to move up into the ranks, not just on the clinical track, but also in the leadership administrative track.
Okay.
Okay, Lillian. Any message before we head into this weekend? Car scores down. Governor's going to ease restrictions next week. The vaccine is on its way. Are you ready? Are you now going to say go out and have a great time, Guam?
No, we still need to be cautious. We still need to be diligent and not, be complacent and not take it for granted that, the car scores go down. We can go and have a barbecue at the beach. Please. We don't want to see an explosion of the cases as what's happening in the mainland. We don't want it to explode. Let's just wait a while. We can still celebrate, but, let's not go all out and have a big bang celebration. Let's just wait. Let's be patient. Wait.
Lillian, I apologize. I know it's a big step down from Benella's Doggo virtual, but Jason had brought, it's Jason's snack day. He brought virtual yogurt-covered pretzels. I'm so embarrassed.
Oh, it's okay. Hey, it's still food.
Snack light, snack light.
Hey, Auntie Lillian, it's Trader Joe's, man. It's not just any yogurt-covered pretzels.
It's
We went to
bougie.
Trader Joe's.
It's bougie yogurt-covered pretzels.
Yogurt is healthy.
Right on.
There you go.
Probiotics. Thank you, Lillian.
All right. Enjoy.
Okay, we're gonna we gotta call an audible here, guys, and move along quickly. We're just gonna squeeze in Public Health Director Janela Carrera because I think she's on site at the outreach testing. And Janela, we just have a few minutes. We gotta hop on a plane and head over to the CNMI and catch up with Kevin Bautista. They're gonna waive our quarantine requirement so we can speak with Kevin from the CNMI Governor's Office. So Janela,
I don't think she can hear me.
I don't think she can hear me.
Oh, hang on. Oh, there.
Yeah, there you are. Okay, Janela. So go ahead. Let us.